So a lot of people ask us whether they should have surgery in a surgery center or a hospital. Well, I'm worried that a surgery center may not be as safe as a hospital. In fact, the exact opposite. It couldn't be more safe to do this in a surgery center. We have the highest accreditation possible at our surgery center, a 3-year accreditation with the AAAHC, and we use only board-certified anesthesiologists who've been working with us for at least 10, almost 15 years now in the same group. And there's some other reasons why it's safer too.
So guys, really the important thing to understand is if your surgeon is working out of a surgery center, you want to make sure that it's an actual accredited surgery center. So there are people who operate outside of that, not necessarily the safest. When it comes to surgeons like us, really well-established practices, you're going to have accreditation, whether it's through the AAAC or quadruple ASF. Those are all different accreditation, and they hold us to exactly the same standard as you would at a hospital.
So all of the life-saving equipment you would find in a hospital is present in our surgery center. We have regular in-services and trainings with our staff. We use the same staff all the time, and that's a really important thing as well. A lot of surgery centers and hospitals, frankly, use per diem staffing, where it's a different team working with you every day. It's great to have the same team that's been with us for a long time because we're all trained up on the equipment. We're always keeping up with our skills and our knowledge base. And more than that, the surgery center can be a safer environment than the hospital for other reasons too, like infection.
Yeah, and that's a fantastic point. You can imagine when we're operating, at our surgery center, there's one patient at a time. They're always healthy people who are, in good health. In a hospital, that's not necessarily the case. You might be getting your cosmetic procedure next to somebody who actually has some sort of infection or problem. So the risks of infection and problems like that tend to be a little bit at an actual hospital than maybe a surgery center.
Yeah, so our view is if you can stay away from a hospital, it's always best to do that.
Absolutely.